During the COVID-19 pandemic, cancer patients have had to weigh the risks of delaying treatment against getting treatment, risking exposure to the coronavirus. That's what we're talking about in this week's Doctor on Call segment. Joining us via Skype is Mark Witte, the executive director of the TriHealth Cancer Institute. This is particularly significant for cancer patients whose treatments weaken their immune systems. Clearly a vulnerable population. It's not the same as someone who's healthy, rolling the dice. I want to go in for a treatment. So, what are you telling them?
Hi, Julie. Thanks for your time. What we're doing is, number one, we're safe and ready at TriHealth. And that safety is, first of all, about our patients. So what we are doing is limiting exposure for patients who come in to our treatment centers. I happened to be at one this morning, and not only practicing social distancing, but limiting the movement of patients within our centers. And in those cases where one of our physicians has a concern about their exposure, we're getting them tested before they would even start treatment. So that's an important part of how we're trying to manage these patients who, as you said, are immunosuppressed. And so our concerns for them are great, and making sure they're safe.
So I want to get into some nitty-gritty with you, if I may. So sure. The patient needs to walk down the hallway. And what we're hearing is that this disease, this COVID-19 virus, is aerosolic, meaning it's in the air and it lingers for a period of time. So someone can walk through the grocery aisle. If you're right behind them, you're walking into the air they breathed, and that alone can expose me to this, okay? If that is true, and I'm told it is, what do you do just moving patients down hallways and into rooms where someone's just been there?
We first of all, we limit the number of patients walking through. We make sure that hallways are clear of people. After every patient visits a room, we make sure that room is clean as quickly as possible so that we limit their exposure. It's a real concern, and to your point, is the exposure can happen in many ways. Every patient, every visitor is screened before they come into our centers, and we're really trying to limit exposure to one another. That's an important part.
We talk about screening people. One of the tricky things about this is we don't know if we have it or not. There's no temperature, we're not symptomatic, and yet we have it. We don't. So for your doctors and nurses and so forth, what is the requirement in terms of the social distancing? They have to get up close to some extent. Do you just rely on that mask to protect the patient?
We have masks, yes, and gloved and gowns in the case of patients who are being cared for, and also using face shields wherever possible. So all of those are elements that we are considering the daily care of our patients.
Okay, very helpful information. I could talk to you all afternoon. I know it's tough stuff right now, and thank you for the care you're taking. Mark Witte, thanks for your time.
Thank you, Julie.
All right.